everyone. I am Camellia Douglas, PMHNP, also known as a psychiatric mental health nurse practitioner. I'm also a nursing and mental health enthusiast. And I'm actually getting on here today. I know that it's been a while, and I always say with good reason, because you guys know I have been very busy, but I wanted to get on here because there have been a couple of things that have come up for me recently and some questions as I sort of mentor others. I have questions that come up, and I wanted to address one particular thing. You guys know that my aim and my goal for this channel is to really give you some insight, perspective, possibly to clarify some aspects of the PMHNP role. And so this particular question has come up quite often. And so I thought that, it would be good to do a video about it just so that I can clear the air here. Also, I did a video a while back about what is a PMHNP, and that video was very generic. If you Google PMHNP, it will tell you the specific responsibilities in a general sense of the role, okay? But somewhere along the lines of just in my career thus far, and some of the things that I was told ahead of time before I pursued this degree is that, there is some aspect of the role that people, whether it's students, nurses, anyone who, comes in contact with PMHNPs, is that we possibly have become or are pill pushers, okay? I don't like that term because I ethically have a real challenge with that type of term. But I wanted to clarify the role a little bit more today and just talk specifically about the idea that a PMHNP, the scope of practice is much bigger than that, okay? So this is for a person who maybe is challenged with the idea of pursuing the PMHNP route because of the thought of becoming a pill pusher, or this is also for the person who thinks that they're going to have just a breezy job with just prescribing medications. Okay, so I talked about the different roles in the previous video, but the full scope of a PMHNP is assessment, it's evaluation, it's diagnosis, it is also education is a huge part of it, and then treatment is sort of the last part that we come to. Most of these things are ongoing, but treatment is the very last aspect of the PMHNP role after you've gone through those other steps. And I mentioned that specifically because treatment can include medications, but it doesn't have to include medications always. There are particular acute conditions where medications sometimes are necessary. However, I don't want you to think of this role as just prescribing medications, okay? I'll give you a few examples as I'm trying to explain this a little further, but I will say, guys, that the other parts and aspects of the role are probably, they hold more weight because they get you to what you're going to be deciding for treatment. So medications can be a part of the plan. I explain this to my patients as well. They're not always necessary, but there are other things that we can do to help mitigate symptoms, to help the patient from a general standpoint in terms of the full picture, okay? I'll give you a couple of examples. So I've come across patients that have had concerns around vitamin D deficiency, significant vitamin D deficiency. And so why that's important is because many times when someone has significantly low or they're deficient in vitamin D, we can see symptoms of depression, okay? Or for example, I've had patients that are midlife and women, and they have had hormonal changes. Sometimes those changes can also precipitate or possibly induce, sometimes mimic anxiety or depression. Okay. Another really common thing is, it's not a common thing, but something that happens and that also leads to the depressive or anxiety symptoms can be thyroid dysfunction. So I mentioned those particular conditions because as a PMHNP, a big part of your role is taking that history and knowing what to do with it. So that's your assessment, that's your evaluation. It's also your education, because you want to be able to explain to the patient that these are things that could be leading to you feeling the way that you're feeling right now. And so in many times, as a PMHNP, you are going to be referring the patient back to either their primary care doctor or an endocrinologist or possibly their OBGYN to have further testing done. Okay. I've had patients come to me after they've gotten those things corrected. And I usually follow up after they have that visit. And their symptoms have improved significantly. And so medications were not necessarily required from an anxiety or depression standpoint. Okay. Medications can still be helpful in those instances. But again, a huge part of our role as a PMHNP is looking at the big picture and understanding why these things are happening. Okay. If we just treat everyone who has a high PHQ-9 or a high GAD-7 with medications and don't really look at the source of what's going on, then we could be missing many things. Okay. And sometimes we're chasing those symptoms. So we're not symptom chasers either. I also usually recommend psychotherapy for patients based on what's going on, mainly because sometimes stressors and other things like grief, they can really get in the way of how someone is feeling. And so if we're just using the medications to sort of fix that, and we're not looking at what is going on that is causing some of those changes, then again, we're sort of chasing the symptoms. So I'm wanting to clear this up, because I really want you guys to think about the fact that there is a bigger scope of practice, whether that's for you as someone who thinks that, oh, this is just going to be a breezy job, or for the person who is possibly sort of deterred from the thought of being a PMHNP because you think that's all you're going to be doing in terms of pushing medications or prescribing medications. Okay, so I get this question a lot, and I wanted to just clear the air here a little bit. I will be honest with you guys, and I actually have, I've tried to be transparent here. You're never going to get anything on this channel that I have not experienced. I'm a few years into my journey, and my goal is to share what I have experienced. It is not to provide any form of a fluff or any form of misinformation. But I'm sharing this from my perspective because I get this quite often. And I will be honest with you guys. I have left jobs as a result of feeling like I was becoming a pill pusher. Okay. Partly because some of the mandates that were driven with numbers, patient numbers, policies around treatment. Whenever I feel like that is only what I'm doing, then ethically it doesn't sit well for me. So if you are feeling like that's where you are as a PMHNP, then I would have you to think about possibly whether you're in the right position, you're in the right organization. But also, a lot of what we do is empower patients through our education. We also provide them with hope. Sometimes we are performing psychotherapy for patients. If someone is requiring psychotherapy where they're needing to be seen more frequently, more often, weekly to biweekly, then I typically have them designate a specific therapist for that. But we're providing the patient much more than medications. I also have patients that just want to pursue the holistic route. They just want to understand what's going on with them, and they just want to be able to do things that are appropriate for whatever that is, that sometimes does not include medications. Now, it is our job if we do feel, for example, if there's an acute situation or a safety concern, that we are actually mentioning and addressing that with the patient. And again, that's big with your education. But I also want you to think about the fact that we are educating patients so that they can make informed decisions about their care. Okay, we're collaborating with the patient. And so anytime you become what people consider a pill pusher, you're really just sort of the driver in the care for the patient, and you're telling them what to do, not giving them usually the information that's necessary for them to make informed decisions. And then also a part of the education is giving them alternatives. If there are alternatives or other things that can help to augment what they're maybe managing that could be causing them to feel a certain way or to be in a certain state of when they come into the office or when they see you for evaluation, then we should be offering those alternatives. There are times where I prescribe patients exercise. There are some studies that support exercise for depression and anxiety management. And so I have prescribed exercise for patients. There are times where patients and we've come up with just a self-care regimen, something, around their self-care. So I want you to think about this from a bigger scope and understand that this role and is just much more than prescribing medications. And so I don't want you to be disappointed on one end of it because you think it's going to be a easy job, but I also don't want you to be disheartened on the other side of it because you think that that's all you're going to be doing and you want more. You want to do more for your patients. So I hope this has been helpful for someone. Many of you have asked me this question sort of as a sidebar, whether you've emailed me or sent me a DM. And I do appreciate you guys keep those things coming. I also want to offer this time up to, request any other things that you guys are not sure about, that you've heard about, specific to the PMHNP role, that you want to possibly be clarified or for me to expound upon if I can. And of course, if there's something that I haven't encountered, I'm going to tell you that. But you guys feel free to keep engaging with me here. I really, really appreciate all of the participation, the engagement, and all the questions and comments, and those of you that have reached out for mentoring and, other things. So keep those things coming, but I just wanted to share this video with you guys quickly today, and please stay tuned for more. Thanks.